All views expressed on the Vecinos podcast by the guests are their own, and their appearance on the podcast does not imply an endorsement of them or any entity they represent, and does not represent the opinions of any entity or the opinions of any of the National Association of Social Workers, the Latino Social Work Coalition, New York University, Nido de Esperanza, the companies affiliated or within the Vecinos Collective. Welcome to the Vecinos podcast. Thank you all for listening. This podcast is brought to you by the Vecinos Collective, which is a vibrant and diverse community of Latinx business and employee resource groups across various industries. Our goal is to foster an environment of inclusion, visibility, and professional development through collaboration, networking, and mentoring for our members in the Latinx community at large. I'm Glenn Guerra, and today's discussion is about addressing mental health during difficult times. And we have an amazing group of panelists joining us. Our moderator for today's discussion is Erica Sandoval, president of the New York City chapter of the National Association of Social Workers. Erica, it's all yours.
Thank you, Glenn. It's so wonderful to just share in this space with all of you. Thank you so much, ladies, for being here today. I'd love to start with just having each of you introduce yourselves and share a little bit about the work that you do within our communities of color. We'll start with Dr. Claire.
Good morning, and thank you so much, Erica. It's really a pleasure to be here with all of you. I'm really excited about this talk because it's so timely and it's so necessary. I am Dr. Claire Greenford. I am currently the executive director for the National Association of Social Workers in New York City chapter, and I am an unapologetic social justice warrior. I firmly believe in the importance of illuminating the disparities that exist in our communities, and as a proud immigrant, issues connected to the immigrant community are very close to my heart. Thank you.
Thank you so much, Dr. Claire. Giselle.
Hi, thank you, Erica. I'm Giselle Pardo. I'm a clinical social worker, native New Yorker, and proud daughter of immigrant parents. I'm currently an adjunct lecturer at NYU Silver School of Social Work and also the co-executive director at Nido de Esperanza. So I just wanted to take a minute to tell you a little bit about Nido de Esperanza. We're located in the Washington Heights neighborhood of New York City, and we work with families with children from 0 to 3. 100% of our families are from the Latino community, and our main goal is to break the cycle of poverty by intervening during the first 1,000 days of a child's life. And so why the 1,000 days? Because the science tells us it's a time of great opportunity, but also vulnerability. Our brains grow more during those first 1,000 days than they do in the rest of our lives. But we also know a child's well-being is dependent on a parent and caregiver's well-being. So we take a really holistic approach to strengthening our families and the well-being of our parents, everything from parenting support groups to ESL classes to trauma-informed yoga, to a food pantry. But more than anything, we are ensuring that we're building community, because more than ever right now, a community is really just critical to families' well-being.
Thank you so much, Giselle. Such incredible work. Louisa.
Thank you very much, Erica. The same as our other distinguished panelists, I am also a social worker, although my focus is more on the government and policy side. I currently serve as Director of Digital Media at the Office of the Manhattan Borough President, and I am the current president of the Latino Social Work Coalition, an organization that is dedicated to increasing the number of Latinx social workers in the field, mainly by providing scholarships for social work students to complete their studies. In both of those roles, I am able to amplify the importance of culturally and linguistically competent social workers in the communities that need us the most. And I am able to advocate for social workers to have the resources they need to work in some of New York City's most vulnerable communities.
Thank you, Louisa. Such incredible nonprofit that is so needed. So I want to start with Giselle. Giselle, there has always been this stigma around mental health counseling with the Hispanic Latinx families. Can you talk about some of the reasons why the stigma still remains today? And what can we do to help our families recognize the signs and symptoms of mental health conditions?
Sure. And I don't think that stigma is just specific to Latino communities, but I do think that within our community, there has traditionally been a great deal of stigma, and recognizing that the Latino community encompasses a diverse group of people, races, regions, languages. So I think there are a couple of of different things that I would highlight just based on my experience is, one, I think that the concepts of mental health, the diagnoses, the terms we use have been really based on Western Eurocentric theories. And for a long time, it was based on a medical model and pathologizing. So for many communities, it feels like if I go to seek mental health services, it's only for crazy people. It's only because it's tienes que estar loco. And so there's just a negative idea around that because for so long it was rooted in pathologizing. Mm-hmm. I think as Latinos, I think we're very focused on family, very family centric. And therefore there's also this idea that if something happens within the family, we have to talk about it within the family. To go outside of it, to air your dirty laundry or to talk about something that's really private could bring shame to the family. We're a deeply religious and spiritual culture, and religion is incredibly important. But I also hear a lot of families talk about how they're going to be okay because they're praying, because they have faith. And that is incredibly valuable. But sometimes we need more than that. Sometimes I do say to families, well, yes, your faith is incredibly important. And God has also put people in your path that can support you. So using that faith. I think there are concepts of traditional machismo and marianismo. So machismo being, I'm this strong man. And if I show any emotion or vulnerability, then it's a sign of weakness. And for women, there's this traditional role of I'm self-sacrificing. I put everyone's needs before myself, my family, and then leaves no room for you to say, like, I have to take care of myself. And I think I'd add that then there's also, distrust of systems, especially in we've just been in these very deep anti-immigrant, racist rhetoric around Latinos that really have driven this distrust of anything that's a government system or a system. And there might be distrust of where's my information going to go if I go get some services. So there's just some thoughts. I'm sure there's more, but I think some of the things that can definitely help is increasing awareness and health literacy about what is well-being. Well-being and healing looks different for everyone. For some people, it might be therapy. For others, it might be getting more grounded to spirituality or doing exercise or being in community. So one, thinking that healing and well-being can encompass many different pieces, and how do we bring that information to the community? And I think partnering with community organizations, faith-based organizations where people already trust, to get that message out, to normalize it, to have conversations in different spaces about mental well-being, especially right now. I think increasing the capacity and the cultural competency and cultural attunement of health providers, because often people, the first place they're going to go is their physician. I'm feeling this way. I have this tightness in my chest. I have this headache. I can't sleep. And often what might be underneath that is depression and anxiety. So how do we make sure that our health providers are also thinking culturally, how are they providing that information, normalizing, giving access to information about mental health?
Such great points. Normalizing can help definitely reduce the stigma. And it's interesting how you really brought up aspects of how we can decolonize mental health and what has been done just within the diagnoses and treatments and the models that exist right now. So thank you for sharing. Dr. Claire, studies studies show that the pandemic has had a disproportionate impact on the community, and an increase in symptoms of anxiety and depression, especially on the Brown and Black Indigenous individuals of color. What are your thoughts about that? And what have you noticed about these patterns in your day-to-day work?
Thank you so much. And I think similar to what Giselle was mentioning, this is definitely connected to systems of harm that have been long created in this country and continue to be fostered, right? When we think about the Latinx and Hispanic community, people immediately think of immigrants, but That's not the story of the entire community. Everyone is an immigrant except the Native American people who this land belongs to. And yet, when we think of it, we always think of it in this way, and we have the horrible stereotypes and imaging that goes with it, right? So that has impacted the way that many communities, many immigrant populations in the BIPOC diaspora, I would say, are experiencing the world. We think of the fact that access to health and healthcare still is a problem. And this was pre-COVID. And so what we're seeing is not disproportionality. We're seeing the reality of the system that has always existed that now people can't ignore. But that is what I think is most disturbing, is that these issues have existed for so long. We've talked about inequality. We've talked about access to healthcare, behavioral healthcare, right? So SAMHSA, who is the foremost authority on behavioral health in this country, has long talked about the impact in the Latinx and Hispanic community for mental health. And same thing for Black community, same thing for the indigenous populations, for suicidality. And it's unfortunate that we're now in the last year really thinking about it. And we're also not approaching it in a culturally humble manner when we talk about treatment. I am from Barbados. Just because that's in the Caribbean does not mean that every single island in the Caribbean speaks the same and has the same language and same culture nuances, but yet we treat the Latinx community as if it's a monolith, right? Many communities are treated as if they're a monolith. But even for myself, having friends from various Spanish-speaking countries, I know that words that my friends from PR say are not the same words my friends from Mexico say, and definitely not the same words my friends from Ecuador say, right? And so that in itself should say we have to approach the way that we understand, intervene, and honor people by acknowledging who they are. And we don't do that, right? So when we look at the numbers and the statistics for Black and Latino communities and the indigenous communities, we're seeing similar trends. The rhetoric in our society would have you think that Black and Latino communities are overly abusing drugs and refuse to go to care. But the reality is do we have providers that speak the language and are culturally humble? Do we have access issues when it comes to a clinic or access to a center that may be God knows how far away from their homes? Are we looking at the fact that unfortunately we continue to have a system that abuses people, particularly those who may not have all of the documentation to be here. And so we create a system where people have to hide, they can't seek treatment, we threaten, and we are creating systems of dis-ease. Anxiety and depression have long been high in these populations because of the systemic violence and racism that these communities have to face every single day. When we look at who's most impacted, again, women, women of color, regardless of socioeconomic background, because this is so important, because we always do the rhetoric of, oh, the poor Black person, the poor, that's not the story of every Latinx person, every Black person, every indigenous person. But what we are seeing is regardless of their story, they have similar outcomes. Socioeconomic status does not have anything to do with the reality of how these communities are experiencing this pandemic and how they've experienced the pandemic of racism and all the other isms throughout their lives. And that is why we're seeing additional challenges in these communities. And let's not even talk about the losses, right? These communities have been hardest hit because of disenfranchisement, because of poor health connections, because of lack of cultural humility in our healthcare systems, because of structural violence and racism. And they're hardest hit. So we're grieving job losses, everything. It's that this is the result of what we have long ignored.
Thank you. Yes, and I love what you just said, which is really sad to hear about systems of dis-ease. It really is. It does ring so many, it just brings so many things to light when you think about that. Giselle, would you like to share more on that? Some more of your thoughts?
Sure. And I think, I want to share a little bit about what we've specifically seen among the families we work with at El Nido. And, I want to just echo what Dr. Claire said about these systems of inequality, of racism, of oppression that already exist that have only been exacerbated by this pandemic. Among our families, many of them were essential workers. So grocery store clerks, delivery individuals, childcare workers, nurses' aides, home attendants, nurses. And, they were called to go to work, and the level of anxiety that they were experiencing to say, I have to show up every day to go to work because I have to provide for my family, but I'm also risking my life and risking my family's life, and potentially getting them infected. And I think, we had some discussions about just this sort of almost whiplash of where, like, there was this time of this anti-immigrant, anti-Latino rhetoric about dehumanizing us. And then all of a sudden, wait, we need you and you're essential and you're important. Many of our families lost their jobs. They saw their wages disappear, and they didn't have the safety nets that other communities have. And they didn't have the accumulated, like, generational wealth that other communities see. So then there was this increased chronic stress of how am I going to provide for my family? Long before the pandemic, at Anida, we recognized how expensive it is to raise a child in New York. And we worked to try to fill that economic gap because it creates a lot of chronic stress for any of us to figure out how are we going to provide for our family. So we would provide things like diapers and formula and baby food. And then this pandemic just highlighted the food insecurity that exists. And so we responded with creating a food pantry. I think Dr. Claire, talked about loss. Many of our families were experiencing loss of loved ones here, but also loss of loved ones back home, and being unable to be with them, being unable to say goodbye, feeling like I haven't been able to go and see my family in years, for different reasons, maybe immigration status, maybe economics, maybe other reasons, but then you're mourning the loss of families abroad. There's the ambiguous loss. So while, that's different than the concrete, I've lost my job, I've lost a family member, but this loss of a sense of safety, of normalcy, of routine for my children. So all of this together, so we saw a real increase in just stress and anxiety amongst our families, and including, I want to say, our fathers, who aren't always necessarily the ones who are the most active in our programs, but some of our fathers started coming to the group. Some of our fathers started reaching out and saying, I need some sort of support because this is an incredibly stressful time.
Absolutely. It's heartbreaking. It's heartbreaking. I know I live really close to Elmhurst, 10 minutes away, and just to hear how horrific the experiences have been for so many is still very heartbreaking. I want to go to Luisa. Thank you so much, Giselle, for sharing that. Luisa, in many cases, the pandemic and its economic impact have only compounded the effects of already existing difficulties, as Giselle was mentioning, such as substance use, intimate partner violence, immigration issues, even political strife from the election. How do you think we begin to counteract those effects? And what approaches have you all taken to show some positive results?
Sure. And, and I think that Dr. Claire and Giselle addressed a lot of this already. But I personally think that the best way to counteract these negative effects of the pandemic and beyond is to frame them as a public health crisis. When a community is facing issues like the opioid crisis in the South Bronx, or immigration issues in East Harlem or Queens, or intimate partner violence everywhere, those issues don't just stay in those communities. We have to start understanding these issues as less about the individual choices that people make and more about the difficult decisions that people from marginalized communities have to make. Giselle said it so eloquently, during the pandemic, a lot of the folks that live in these communities have been deemed essential workers. Some of us can afford to stay home to work, but a lot of us can't. People have to put themselves in harm's way in order to put food on the table. Many of the folks that were deemed essential workers, they had to go out into the world. And how different would the effects of the pandemic be, not just in distressed communities, but everywhere, if people had been paid to stay home, as other countries did? I think that all of these issues are connected. These are economic and systemic issues, and the way forward is to address them in the systemic inequalities in a systemic way. Things like lack of access to quality healthcare, lack of access to nutritious food, people living in food deserts, access to safe and affordable housing. These are all issues that lay at the base of the pandemic response, and addressing them is the way forward in addressing them on a larger scale.
Thank you so much, Louisa. Yes, I was thinking about that specifically. Like, what are some of the barriers that Latinos face in getting good access to quality care and treatment? And I'd love for Dr. Claire and Giselle to also chime in. Dr. Claire?
Yeah, sure. I think one of the main challenges is services that are culturally humble and provided in a language that people can understand, right? Like that's a huge gap. We have research shows a vast majority of the Latinx community and Hispanic community that have immigrated here, particularly when we're speaking of more seasoned folks, don't speak English or have limited English proficiency, but yet the services that they're accessing are predominantly in English, right? You know, even when we think of the fact that people have a language line, I've had to use language lines, that's really awkward, right? Because being able to communicate with someone is important. Being able to ask questions and for them to feel comfortable is so necessary. And yet we don't have culturally humble, multilingual, multicultural services, and yet then we say, but people don't access them. We've not provided an avenue for people to access the services. It's not non-compliance. It's not a refusal to go to treatment. We refuse to provide treatment that actually honors who people are. So I think that's one of the big challenges. It's also an issue is of access to healthcare. The reality is healthcare in this country is a privilege. You have healthcare connected to your employment. A lot of people don't work in jobs that provide them with healthcare, or the costs are so astronomical they don't have the option to have healthcare. It is difficult having conversations that I've had with people several times. Well, I have to make a choice of whether I pay my rent or whether I go to the doctor or whether I am able to put food on the table. No one should be in that position, and yet hundreds and thousands of people in this city are in that position. So I think not only is it an issue of refusal on our part for healthcare providers and the systems to provide culturally humble responses and interventions and treatment, there's also ignoring of the reality that people don't have access to care. If you don't have insurance, you can't seek treatment. And then the other challenge is that for those communities that are immigrants, the additional pressure that we've placed on those communities and harm, particularly with the rhetoric of anti-immigration policies that are basically based in racism, those policies also, and the practices, right? Like ICE being out and doing all the raids. We have created such fear, and we've created an environment that says don't seek help. We've seen the studies that have talked about the fact that people are less likely to seek help because of this fear, but yet we also send the message that they should seek help. It's a mixed message, but it's also a message that continues to create such harm. And we're seeing the rise of anxiety, the rise of depression, not only in older populations, but in our kids, right? Like school has been a stabilizing factor. That's gone. People, to Giselle's point and to Luisa's point, are deemed essential workers, and now we say, oh, they're important, but we've not thought they were important before. We've not provided security nets for them and their families. We are asking people to risk their lives and the lives of their family. We're not considering the fact that New York City is not affordable. To me, it's an oxymoron to say anything in New York City is affordable. Even affordable housing programs, you'll see a studio apartment for $1,800. That's not affordable. Most people don't make that much. Even people, regardless of wherever they come from, educated people, whatever may come out making $40,000 a year, that's not $1,800 a month. And so we have continued to create the system of have and have nots. And what we're really saying is, if you are wealthy, if you're privileged, if you are not considered other, then you are deserving of care. However, if you are the other, you don't, because we don't see your humanity.
Absolutely. The fear, the trauma, everything that our communities are facing is so, so real and compounded with more and more experiences that we're all experiencing, but for them, it may be very, very deeper and very different. Giselle, would you like to chime in a little?
Well, I think Lisa and Dr. Claire have covered a lot. You know, one thing, I think the original part of the question was like, what can governments or, you know, agencies do in terms of just responses? And, you know, one thing that has, I think that's important is that many in the Latino community, and I know many of the families we work with, are excluded workers in that they don't get to get the unemployment benefits. They're not getting the federal stimulus checks because maybe they're undocumented or whatever their situation may be, but they're excluded, or they don't have sick days because they're in these very precarious jobs that don't give them all those benefits that really should just be a right as a worker. I know the New York Immigration Coalition is doing really important work around, at least on the state level, advocating for policy that is going to protect those excluded workers under COVID and under any other kind of disaster situation that may happen where other workers would get benefits, would get unemployment. So just kind of getting informed. I think you can always go on New York Immigration Coalition's website. They have amazing different initiatives. There's a campaign around coverage for all. So what Dr. Claire was speaking about, making sure that, you know, everyone has access to care. It should be a human right rather than a privilege. And so those are things that I think we can do on a kind of greater level, and that anyone can get involved and say, how can I get more informed and just help, you know, advocate for these changes on the state level.
Absolutely, Giselle. Thank you so much. Luisa, it was just so incredible to hear about Latino Social Work Coalition and the mission. So I want to pose this question to you. What do you think healthcare providers can do to help address some of the disparities with access to healthcare and opposed to the work that we're also continuously doing in bringing more providers that are linguistically appropriate and culturally humble, as Giselle was mentioning?
Sure, sure. I think that, you know, increasing awareness is the key to all of this. You know, something that healthcare providers can very concretely do is learn about and be aware about the racial and ethnic disparities in healthcare among the general public. You know, I've been to doctors who don't take into account my ethnicity and my experiences in the diagnoses of whatever the case was. That, you know, like Dr. Claire says, it's a lack of cultural humility that does not accord people the respect of their lived experiences. And that is no way to address all of the disparities that we've been talking about in this conversation. There also needs to be, there's a fragmentation right now of healthcare plans that falls along socioeconomic lines. There are healthcare plans that cover mental health services. There are healthcare plans that don't cover mental health services. And you can imagine that the ones that do are the ones that cost a lot of money. Not everybody works in a place that offers healthcare, and not everybody, even if they do work in a place that offers healthcare, can afford to pay a premium of, you know, God knows how much a month when you have to put food on the table and you have to pay rent and you have responsibilities. So the way that healthcare is handled in our society as a whole is truly a component of why we're seeing these disparities down the line. I think that there also needs to be a strengthening on the stability of patient and provider relationships for publicly funded health plans. The level of care that you get at public hospitals is wildly different than what you get than if you go to a Mount Sinai or something. And that again leads to these contributes to these disparities greatly. And finally, to the point of the Latino Social Work Coalition, we need to increase the of underrepresented racial and ethnic minorities among mental health and just health professionals. There need to be more of us that are able to be culturally humble, that are able to speak the language, that can, decipher what a person that has nervios means. When they say that they're nervous, it means that they're anxious. There's anxiety there. And I doubt, that someone who has never had experience in that community or that speaks the language will be able to make that determination and be able to appropriately say, you are suffering from this and this is what your treatment will be. So I'm so grateful for organizations that recognize that those disparities exist and are working really hard to increase the number of culturally humble and competent social workers and doctors and nurses and EMTs that are working in these spaces with communities that need this level of support.
I agree 100% with you, Luisa. Social workers are so essential and they are the glue to the team in healthcare settings. They really are the individuals that are connecting, that are speaking to the families, speaking to the team, and really helping the team understand what the family, what the person is impacted with. And to have more social workers that are able to speak the language and are able to communicate with a culturally humble lens is so important. And I think also, I just want to add to that is also, I think the healthcare teams really need to think about equity and how they need to really pay appropriately to the Latinx professionals that are in these spaces for the skill sets that they bring to the table. So thank you so much for sharing that. I also want to ask you a little bit about, there's a lot of misinformation out there about the vaccines, Luisa, and which has led to a lot of anxiety, nervios, and reluctance, even among healthcare workers to get the vaccine. What can we do to ensure that people get the right information and reassure them that the vaccines are safe? And what else can local government and companies and individuals do to help bring awareness to mental health issues? And what are some of the ideas that you've come across that you think can help fix those issues?
Sure. Again, Giselle and Dr. Claire talked a little bit about this before, so I won't gild the lily too much. But definitely, the far-reaching influence of vaccine misinformation stems from a skepticism of political institutions and public health systems. In times of crisis, we look to our government and we look to, and in terms of health crises, we look to our health establishments to lead us in providing protection to the community. The public's trust, however, you can't always count on it, especially, when there is a lot of misinformation and in a lot of cases, just no information, as was the response from the federal government with COVID-19. There was a time, there was about a month and a half where there was no information other than people had it and people were dying. And the federal government didn't say anything and try to hide information. We saw that in our daily news briefings when they happened. And that led to people questioning the effectiveness of the government's response to the pandemic. One thing that I think government can do and organizations that work with government can do is really equip the public with the digital literacy skills that help them recognize misinformation. The COVID has made everything virtual now, so it behooves government to make sure that people know what to look for how to recognize when something is true or fake news, and what to do when you encounter that, right? Um, the problem of vaccine misinformation isn't just that it exists, it's that it's easily shareable. It's super easy to read something, alarming on Instagram or Facebook and just click, press share, and now your network knows about it, and then they'll read it and they'll get alarmed and they'll share it with their network. So addressing that in a way where people know what misinformation looks like is super important. One example is in Canada. In order to teach people these skills, the government funded the Check First, Share After campaign on social media, which was run by a nonprofit organization called Media Smarts. And the point of that campaign was to show people how sometimes misinformation looks like it's the real stuff. So you really do have to invest the time in that whatever you're sharing is actually valid information. Another tactic, which Giselle mentioned earlier, is increased community engagement. Digital outreach has to be supplemented by folks in the community and organizations in the community that are trusted messengers, that are credible messengers, that people will listen to and will understand. There was a report published by the Johns Hopkins Center for Health Security that said that, addressing the concerns at a grassroots level by mobilizing local leaders and personal medical providers is incredibly effective in counteracting any kind of misinformation. I think back to, being a kid in Washington Heights, and, if there was like a flu going around in all of the local schools, we all went to the same doctor. We were all cured within days because every kid in my building went to the same doctor, and the doctor was, prescribing the same medication and giving the same advice. There's no reason why we can't mobilize those trusted doctors, trusted social workers, trusted community-based organizations like NIDO. For us social workers, NASW, NYC, there's no reason why we can't mobilize these groups to indicate what the proper vaccine information is, and really utilize our standing, right, as trusted messengers to put that message forward. Yeah, I mean, it's all about information, just like everything else. It's all about information and who has access to that information, which is why, you can't just have a digital component. You have to have a grassroots, on the ground, on the street corner. You got to activate your vecinas and the vecinos and your local nurses and the lady that talks to everybody in the bodega. You got to activate those people and bring them in so that they can be your trusted messengers.
Yeah, I love that. Activate your vecinos. Absolutely. It's so important to normalize and to also have those conversations. And even as individuals, as for us who are speaking to our families, to our friends, to our close loved ones, we also need to be able to spread the accurate information and really dismantle the beliefs of fake news and help and educate our family and friends and loved ones. Thank you. I appreciate.
I just want to add something to that, Erica. I think that the fears of our communities and the communities that we serve have really been weaponized against us. And that, I think that speaks to a deeper level to the challenges that this country is facing right now. The real economic disparities between groups, the racial fears that some folks have. Those feelings have been weaponized to our detriment. And, I don't think anybody's going to come to save us. So we have to save ourselves, and we have to, utilize the full breadth of our experience, of our connections, of our networks, podcasts like these, to really get the word out on how we can educate our communities, how we can lift our communities from the ground up. because, as someone who works in the government space, I don't think anybody's coming to save us. So we really have to put in the work, the double work on top of our on top of our actual work, to make sure that those messages get through and that our communities aren't, buried under the fear that someone else or another party or whatever, have put there as a barrier.
Absolutely.
Mm, yeah.
Organize and advocate. Absolutely. Dr. Claire,
Yeah.
I want to, just ask, just please feel free to jump in, and also tell us what you think about this, the trauma that was caused by the pandemic will be with us even after most
Mhm.
people are vaccinated. What are some of the tips and resources you can share that will help families cope with the ongoing trauma?
Absolutely. Thank you so much. And I wanted to jump in on what Luisa was saying, and I'll get into the question you asked, if that's okay. I think, Luisa, you took the words out of my mouth about the weaponization of our fears. And in the community, I trying to jump in to say that, yes, because we have to acknowledge the fear because it's based in legitimate experience, right? Like, so I think part of the challenge has been we're not acknowledging that these fears and the distrust of the healthcare system are justified. And we have to acknowledge that, right? I've seen some people doing it in some communities, but I've also seen the other side of, oh, there's no reason to be fearful. When you do not acknowledge someone's experience, you shut down the conversation. We have to first acknowledge the fact that for many communities, particularly Black, Latinx, and Hispanic communities and Indigenous communities, the healthcare system has been a system of harm, not a system of help, and still is. And so when we look at the numbers from infant mortality and everything else in this time period, not 1900, but 2021, we're still seeing very similar trends to what we saw 200 years ago, right? And so we can't ignore the fact that they are true experiences that are ongoing, that are traumatic, that are destructive, that are dehumanizing, that continue to happen. And we have to have those partners, right? We have to have, to your point, those trusted partners, the allies. We have to step back and from our thoughts of being experts and allow the true experts, the community members, the clergy, the people in the bodega, those people to lead the conversations, because that's where the healing is going to happen. And that's where the information is going to be shared. And if they are partnered with these entities, Department of Health, other government entities, and ASW NYC, then we can actually create a true way to influence, impact, and to support the needs of the community rather than going in as the experts as we typically think that we are. To your question, Erika, about the trauma, absolutely. I mean, all I keep thinking about is the babies, right? Like, I mean, the whole scam, but I love human development, and I think about the significant neurological changes and impacts to our children and adolescents, to the families. I think about the impact of families in general and adults, right? Because we know that stress is our number one enemy, whether it's connected to inflammation issues and a lot of dis-ease in our bodies and our minds. Stress is unfortunately the number one uh, thing, and yet is something that communities of color consistently live with, right? Like, it's in every aspect, in every area, you're seeing these issues with stress, financial stress, right? Again, essential workers, regardless. And I want to challenge the rhetoric that is so often out there of only the low wage worker, because we're seeing this in people, regardless of socioeconomic status and background, when it comes to sharing a cultural and ethnic identity. Latinx and Hispanic, Black, we're seeing it across the board. So I'm concerned about what's happening for our kids. And I'm concerned about what's happening to our kids and their families. Our kids are also dealing with loss, right? They're dealing with loss of loved ones, whether there's been a physical death that's happened, to the point losing loved ones who are in different parts of the world, different parts of the country. All of that is incredibly painful. We've lost a lot of routine. Children need routine. Neurologically, the way our brains are designed and the way that we grow our brains is connections. We've lost connection. And so our kids are going to have long stemming impacts that we have no idea about. at all, because we cannot see that far into the future. But we know that educationally, children are going to be behind. Socially, they're going to be behind. Kids learn by running around, jumping on things, being really loud, playing really loud music that annoys all of us. That's how they learn and grow, and they don't have that opportunity. We're also thinking about the trauma that families are going through when they are living in, in areas where they can't isolate, right? I've talked to so many people who are talking about the fact that it is a privilege for us to even do what we're doing, right? Like, we have a space, no matter how small it is, where we can have a private conversation and do this podcast. When you live in a home with multiple people trying to go to school at the same time, if you're privileged enough to work from home, then there's a trauma that's also there, right? Because now you're congregated, you have no escape. People have talked so often about not being able to escape. There is no place you can go where you can escape the realities of COVID. There's no place any of us can go where we escape the realities of what it is to be women of color, right? Like, we can't hide that. There's no passing, there's no blending in. We are who we are. We carry who we carry with us, and that means we're carrying our countries, we're carrying our cultures. That is such a heavy weight and a burden that we have to carry, right? Like, I think often in so many cultures, to Lisa's point about in many Hispanic communities, women being the suffering person and putting yourself out there for everyone else. That's something that in so many cultures, as women, we're told we're supposed to do. Why? Right? And so there's so much trauma that's happening, and then I think of the trauma connected to who you are, the challenges with immigration. I'm really proud that NASW New York City has been doing this immigration fight long before it was trending. We have been sounding the alarm. We have an amazing immigration committee. We have connections to our national office and our local office where we are pushing agendas, where we are calling people into the space to talk about the racist policies, because they are racist, and what they're doing to families and communities. We've been sounding the alarm about issues at the border, regardless of administration, because these issues have existed regardless of who's been in office. And we are continuing our efforts to ensure that people are seen as people and that we stop dehumanizing. And we will continue to raise our voices, because at the end of the day, we know that all of this disenfranchisement and isms are deeply connected to the trauma and the profound experiences that people and communities and families are experiencing. And we know that trauma has long lasting impact neurologically, maternity wise, family wise, incarceration, education. I cannot think of any system that is not impacted by trauma. And we're creating a situation where we are going to have the ugly effects of compounded trauma and generational trauma, not only because of COVID, but again, because of the systemic violence and racism that we have long bred, that is coming to a head and killing our people, because people are dying. There's a reason we're dying at disproportionate rates. There's a reason that Black and Latino populations, Indigenous populations are mirroring the deaths, even though they represent such a small percentage of the population in this country. That's not an accident.
Absolutely. It just reminds me of everything that we learn as mental health providers, and how we learn from each other, and the books and the articles and the narratives that are out there, that how the body keeps the score of all of the trauma that we're experiencing. And I just want to kind of go back a little bit, because I did want to highlight some of the ways that you can note if you or someone needs to seek some additional support and there are symptoms. And Dr. Claire and Giselle and Louisa, you brought a lot of this up. And you know, it, when you said inflammation and pain, like, that's a symptom of really needing support to support your mental health wellness. You can be tearful and you may think you're depressed, but it could be underlining anxiety. You can have like loss of sleep or too much sleep, or you may feel like you're having a heart attack, and these shortness of breath can mean that you're having some anxiety. You may wake up that way. You may go to sleep that way. You may feel that way. And then you're thinking you may need to go to the hospital, and then you're seeking health care from a physical doctor, and they're saying there's nothing wrong with you. And then it seems like you're just experiencing this as somatic symptoms these are just signs that we want to recognize that say, hey, I need you to love me. I need you to go and help me out. And we want to normalize that for our families and our friends and also for our kids. You know, they may become more irritable, they may become less motivated to do their schoolwork, and it doesn't make them less intelligent or anything like that. It just means that they are needing something that they don't have access to right now, and that's socialization. And so that irritability, the tantrums, the lack of motivation, and not doing well in school, like, you just give yourself, even as adults, permission to be okay and not take it personally, because it's not about I'm not a good parent or I'm not a good caretaker, and just be able to just be okay with that and move forward and figure out where can I go for support and how can I seek support, because we all need support right now. So I just want to say thank you so much to all of you for sharing in these incredible gems. And I would love for each of you to talk about some of the initiatives or organizations that you're working with that are dedicated to mental health awareness and anything else that can support us. And also, where can our listeners find you and how can they contact you if they want to get more involved with your initiatives? And I'll start with Giselle and then go to Louisa and then Dr. Claire.
Sure, thank you. And I just want to kind of add that I think I always try to think about the fact that wellness and healing looks different for everyone. And so in this moment, yes, some of us may need to reach out, get counseling, get therapy. Some of us may need to just be in community and find ways to be in community and in virtual community. Find that one person, your person, who can hold space for you, right? Just listen and be non-judgmental. To the parents, as we were doing this podcast, I had a young person interrupt because they were having a problem with Zoom. And so as parents, I think what you said, Erica, that we just have to be compassionate and forgiving with ourselves and know that it's not going to be perfect, right? But that we could always go back and repair, which I'll have to go and repair and say, sorry, I ignored you, but there's a reason. So just wanted to say that we have to find the thing that works for us. And maybe it's getting out and doing exercise, and maybe it's listening to music, and meditation doesn't work for everyone, but find the thing that works for you. And know that there's help out there. So a couple of things I think in terms of the work that Nido is doing, and that kind of touches on several things we just mentioned, is we're trying to bring the information to the community. So we are bringing in people to do workshops on toxic stress and what does toxic stress look like for you and for your child, information on the vaccine. So we're bringing people into our space because I think our space is a place that we've created community and people feel safe. Our organization is located in a church. While people of all faiths are welcome, the church is a safe place. And I think bringing in that information and bringing in workshops to a space where people already trust is going to help increase some of that just information about mental health, information about how do you take care of yourself. And yes, we have social workers who are all bilingual, bicultural social workers on staff that can offer that one-on-one mental health. We've partnered with New York Presbyterian to have a lot of their health staff come in and speak, and specifically their Peace Family Trauma program that's come in and done workshops for us and support for our families. I think your question was, so I think you can go on Nido de Esperanza, you can Google them, you can find our website, find out more information about what we're doing. I'm trying to think of the other answers to your question. Another point is I think we're also, as social workers, we're always trying to approach our work from a strengths perspective, right? Remember that we are resilient, and as a community, we're descendants of resilient people who've been colonized, been oppressed, but are survivors. And so finding ways to also build on the strengths of our communities and of the families that we work with, I think is incredibly important in this moment where there's so much trauma. I think we also need to hold on to some hope and some strength and some resilience. So I think, again, our website, my email, which is Giselle at nidodesperanzanyc.org. You can get more information about the work that we do, also about opportunities to volunteer, because we're always looking to increase our community in ways that people can come in and support the work that we do.
Thank you so much, Giselle. Luisa.
Yes, thank you. Thank you, Giselle, for all that information. That's wonderful. And I love El Nido. I love El Nido so much. You guys do amazing work. As I shared before, the Latino Social Work Coalition is dedicated to raising awareness and to raising funds to alleviate the lack of culturally competent social workers in the field. We believe that one of the ways that a lot of these systemic issues that we talked about today would be better addressed by a core of dedicated, linguistically humble social workers that understand the challenges that distressed communities face. To that end, we are currently fundraising for our 2021 social work student scholarships. And I encourage everyone listening to donate to this year's scholarship fund and to stay in touch. We have our leadership awards coming up in May, which is our premier event of the year and an opportunity to learn more about us. For more information, you can contact us. We're online, latinosocialworkcoalition.org, and you can email us at info@latinosocialworkcoalition.org. We look forward to hearing from you and connecting with you. If you are a social worker in the tri-state area, please get in touch. There are a lot of opportunities to get involved, to volunteer, to join any of our upcoming committees that are really going to be geared towards creating a space for social workers to connect, to network, and to debrief about the things that you're seeing out in the field. So please get in contact. We'd love to hear from you and we'd love to connect with you.
Thank you so much, Luisa. Yes, and all I've been hearing is we need more bilingual social workers, and there's just not enough of us. So just in applauding the work of Latino Social Work Coalition and El Nido. Thank you so much. Dr. Claire.
Yes, thank you. It's so awesome to be on here with you guys. This is the highlight of my day. I am really excited to share about NASW New York City as well. Similarly, we are a membership-based organization that represents social workers, but we are the home for all social workers and want to continue to build that. In the last few years, we are certainly focused a lot more on our social justice and equity issues and raising up BIPOC social workers and BIPOC communities and the issues that we face. Social work exists within the framework of the society we live in, which means we are impacted as a profession by the isms. And so our work is working to address those issues, to highlight, to advocate, and to bring awareness to the issues and challenges so that we can make change. A big part of the work that we do is advocacy and legislative work and policy work. So we're not only working to bring awareness, we're also working to change the policies and the regulations in the state, in the city, that can continue to foster systems of inequality and harm. We have been pushing racial equity bills for a while. We continue to do that work to ensure that we have a mechanism in this state that holds accountable those who are making our laws and regulations. And so that's a big thing that we continue to do. We're also doing amazing work with our BOLD initiative, which is building, organizing, and leading with diversity. That initiative started in the summer and has continued to grow, where we are bringing social workers from all across the city and honestly across the country, because it's open to anyone, to talk about issues that are happening in our profession, but also to talk about tangible ways that we as individuals and we as a profession can work to create a more equitable and just society. So I do invite you to join us in those efforts, to become a member, because your membership allows us to continue our advocacy efforts. We have a lot of committees. As I mentioned, we have an immigration committee, and they do a lot of work locally and with our national office to ensure equity and to ensure that the challenges and needs of the populations that are most impacted by many of our biased immigrant policies are supported. We have trauma and disaster committee. We have committees that are focused on the LGBTQ+I community, and because our work is to be inclusive. And so you can find us on Insta, on Facebook, on Twitter at NASWNYC. You can also go to our website. You can just Google NASWNYC and you'll find our website and the host of ways to connect with us. And I think that that is our work is to connect with organizations such as Latino Social Work Coalition and a whole bunch of other organizations so that we can work to ensure that our mission of inclusion, our mission of uplifting those who are marginalized and oppressed is actualized. And so I am really excited about the work that we're doing. We have incredible leadership, and it is our life's mission to make the world a better place. I wanted to also end on a quote because I think it's so important as we sum up some of the things that we've talked about here. Nelson Mandela is one of my favorite people in the world. And he has a quote and it says, if you talk to a man in a language he understands, that goes to his head. If you talk to him in his language, that goes to his heart. And a big part of what we've been talking about today is in order to ensure equity, we have to speak to people in their language so that we can touch their hearts.
That's right, Dr. Claire. Thank you so much. And I'm going to give a guilty plug for all of these three incredible organizations. There's always a need of support from corporate partners to continue to drive our missions forward, to continue to provide access to our communities. And there's always an opportunity to partner with organizations such as El Nido, NASW New York City, Latino Social Work Coalition, to really ensure that you are meeting those marks of supporting the diversity, equity, and inclusion lens. Because these are the communities, these are the organizations that are doing the work from the ground up. And without organizations like the three of your organizations that you're representing, we would not have the place that we have today. And it does take a village, a huge community to create a larger impact. So we invite all of our corporate partners to come and learn of the organizations, see how you can support in these initiatives. And I also want to say thank you so much to Vecinos for having us here and helping us and sharing in this space with these incredible gems. And I really appreciate the opportunity. And thank you again, Dr. Claire, Louisa, and Giselle for your time and all the work that you are doing. Incredible, incredible work. Thank you.
Thank you.
Thank you.
That's all the time we have for today. We want to thank our panelists, Dr. Claire Greenford, Luisa Lopez, and Giselle Pardo. A special thanks to our moderator, Erica Sandoval, and a big thank you to all our listeners. Special thanks to everyone in the Vecinos Collective and all the amazing ERGs and BRGs who make up our organization. You can find us on LinkedIn. We are the Vecinos Collective, and follow us on Instagram at VecinosNYC. Remember, we're here to discuss the important issues that matter to you. We'll see you next time.